My name is Erin Montgomery, and today I'm going to show you how to do intradermal, subcutaneous, and intramuscular injections. So the first thing that I would do is check my MAR and check the order for the injections. That'd be my first check. Then I would check all of the medications, make sure that I knew the correct dosages, the adverse reactions, and anything else I would need to know. And then I would get it out of I would unlock the MAR, or the drawer, take out the medications I needed, and then I would compare it to the MAR again. That'd be my second check. I would make sure that the expiration date were in range and that the patient was not allergic to this medicine. I'm going to go ahead and show you how I withdraw the medicine from the vial. I do hand hygiene, and then I'm going to get an alcohol prep pad, clean off the top of the vial. Using the OK method, I'm going to remove the cap, withdraw some air without touching the plunger. And then push the air through into the air in the vial, turn it upside down, hold it, and then withdraw the correct dosage. And then using the scooping method, I will recap my needle for later use. You don't want to come on. There we go. Normally these needles would have safeties, but I've had to record this video and I've messed up multiple times, so I had to find needles and they did not have safeties. So now that all of my syringes had the correct medication in them, I would go and do any assessments that I need to on my patient, and I would ID the patient with 2 patient identifiers, check their bracelets, make sure there's no allergies to these medications, and then I would do hand hygiene and gloves. First one I'm going to do is the intradermal. That is a 25 to 27 gauge needle, and it is given at a 5 to 15 degree angle. Get my alcohol prep pad, working in small circles going outward. Pick up the needle, OK method, 5 to 15 degree angle. Just pull the skin taut. Pull it out, and then safety on if it had a safety into the sharps container, and then give them a clean gauze pad to blot. Tell them not to rub or itch. And then the next one I'm going to do is the subcutaneous. This one, it's usually insulin. It is a 20 to 25 degree gauge needle, and it's given at a 45 to 90 degree angle depending on the adipose tissue that the patient has. This patient has adequate adipose tissue, so I'm going to give it at a 90 degree angle. OK method, just take off the cap. Since they have plenty of adipose tissue, I don't have to squeeze. And then I will let go. Again, no safety because it doesn't have one. And then give them another to blot with. Tell them not to scratch or itch it. Make sure that none of these are getting red. And then the next one is an intramuscular. This is given at a 90 degree angle, and it is a 20 to 25 gauge needle. Subcutaneous is a 25 to 30 gauge needle. Cleaning from the inside out. Now this, I'm going to use the Z-track method. So I'm going to uncap my needle. It'll come on. I'm going to pull the skin back, and then 90 degree angle, and then inject. Take the needle, or let the skin back, and then take the needle out. Safety, if it had one. And then give the patient another thing of gauze to blot with. Tell them not to itch, and then I would check every site and make sure that it's not discolored or red or not irritated in any way. Then I would take my gloves off, hand hygiene, record and report.